From the nonpartisan Maddy Institute and the California channel at the state capitol, this is a Maddy Policy Brief. Welcome back. Children in foster homes are by definition wards of the state. And while some are troubled youth and need help with psychotropic drugs, the inappropriate use of those drugs can have short and long-term consequences. We're talking to the California State Auditor, Elaine Howell, about a recent report her office issued on the use of psychotropic medications in California's foster care system. So I'm wondering, this is not a problem that's unique to California. Lots of states are dealing obviously with foster kids. I'm wondering if other states maybe have found solutions. What are the best practices that are occurring maybe in other states?
Right. We talk in the report about a couple of states, the state of Texas and the state of Illinois. And in the state of Texas, they essentially, rather than having a fragmented system, it seems to be a very streamlined process where there's one agency that's responsible for all of these different activities as far as making sure the child has the appropriate prescriptions if the child is prescribed psychotropic medications, what mental health services are being provided to that child, making sure that all of that is being managed centrally under one entity. In Illinois, it's a similar situation where they do manage the mental health services and they have psychiatrists within a particular state agency. So it's not fragmented in those states. So there may be some best practices California can learn from those two states.
If the passports were accurate, that could probably fill that need if we made sure those things were accurate. If they're not, of course, the whole system falls apart. You've made also some specific recommendations for the legislative action, what you'd like to see the legislature do. What would you like to see them do to address this problem?
Right. We have specifically made some recommendations to the legislature and really directing state agencies. We think the agency that should be essentially the lead agency when you have all this fragmentation, you need to have one agency, and we think that should be the Department of Social Services because that's the agency that has the database with most of the information about the children. What they're lacking is the information from healthcare services related to the medications. But there's an easy fix to that where that information can be input into the social services database, child welfare system. And then there can be coordination and collaboration between those agencies, but also we told the legislature to direct social services to work with local partners, the county welfare departments, the county probation departments, the caregivers, the social workers, et cetera. Do a better job in collaborating and coordinating with them.
Yeah, it seems to me whenever you have a situation where no one really knows who the leader is, there is no leader, and then it just becomes, very disorganized very quickly.
Right.
You've also talked about the Medical Board of California and their role, the important role that they have here. What are you recommending the medical board do to help improve the situation?
Sure. We do have some very specific recommendations to the medical board that they need to be working with the Department of Social Services, certainly with healthcare services, and getting that medical information related to the children and try to identify perhaps some physicians out there who are prescribing multiple medications inappropriately, inappropriate dosages, have some kind of a trigger where they can investigate and determine whether or not they have problematic physicians. So we're telling the medical board, not just on the data that you currently have from DSS, but establish an ongoing process to do this kind of monitoring. There may be a reason why a child is prescribed a dosage that's higher than maximum, but it needs to be completely vetted.
It's not always wrong to do that.
Correct.
There may be a justification.
There may be a rational explanation for that, but if you're seeing patterns of certain physicians over-prescribing or prescribing beyond the guidelines, that will trigger a question or an inquiry. And then you at least have assurance that, yeah, that's been well thought through, or we have a problem here and we need to address it.
It's interesting, the San Jose Mercury News did an investigation. They found that in San Bernardino County, one psychiatrist prescribed antipsychotics to 328 foster children, 85% of his patients. Another situation in Riverside County where the person was a self-proclaimed spokesman for the pharmaceutical companies, and then another in San Diego where they once prescribed an antipsychotic to an out-of-control kindergartner. I mean, it's a kind of examples of abuse of the system. So what would you like to see state agencies like the Department of Social Services do that they aren't doing now to deal with troubled foster youth and over-medication? Is there?
Again, it ties back to a lot of what we've talked about today as far as making sure that, again, the Judicial Council has done a good job is making sure those forms that require court authorization are fully filled out and all of the information is in there. Making sure that when they go out and do some site visits at the counties, they check these health and education passports.
And those passports seem very important.
Compare it to the database that they have and make sure that that information is accurate and complete, because that really is the profile. That's the critical information for those children.
And what about counties then at the local level? Everything seems to happen at the local level.
Sure.
What would you like to see counties do?
For a more in-depth analysis of this and other public policy issues important to Californians, please log on to our website at maddyinstitute.org and click on the Policy Analysis tab.